Hello, good morning. I'm here for my appointment.
Good morning. Welcome to our dental clinic. My name is Dr. Sarah. How can I help you today?
Thank you, Dr. Sarah. This is my first time at a dentist, so I am a little nervous.
Oh, do not worry at all. Many people feel nervous on their first visit. I will make sure you feel comfortable the whole time.
That is very kind of you. I really appreciate it.
Of course, that is my job now. Can you please tell me your name?
My name is David. Nice to meet you, Dr. Sarah.
Nice to meet you too, David. Now, before we start, I need to ask you a few questions. Is that okay?
Yes, of course. Please go ahead.
Great first question, David. How old are you?
I am 28 years old.
Good. And David, is this really your first time visiting a dentist?
Yes, it is. I was always a little scared, so I never came before.
I understand that, David, but you made a very good decision by coming today. Taking care of your teeth is very important for your health.
Yes, I know I finally decided to come because my tooth has been hurting for a few days.
I see which tooth is hurting. You can point to it or tell me if it is on the left or right side.
It is on the right side at the back of my mouth. It hurts when I eat or drink something cold. Sometimes it also hurts when I eat something sweet like chocolate or candy.
I understand that kind of pain is a very common sign that the tooth may have a cavity or a small hole in it.
A cavity? What exactly is a cavity, Dr. Sarah?
A cavity is when the hard outer layer of your tooth called enamel gets damaged and a small hole forms inside the tooth.
Oh, that sounds a little scary. How does a cavity happen?
It usually happens when we eat too much sugar or sweet food and we do not clean our teeth properly after eating.
I see, so eating too much candy and chocolate can cause cavities.
Yes, exactly. Sugar feeds the bacteria in our mouth, and those bacteria produce acid, and that acid slowly damages the tooth.
Wow, I did not know that, so bacteria is the real problem.
Yes, bacteria is the main cause, but do not worry, David. We can fix this together.
Okay, I trust you, Dr. Sarah. What will you do first?
First, I will look inside your mouth and check all of your teeth. This is called a dental examination.
Will it hurt?
No, the examination does not hurt at all. I will just use a small mirror and a small tool to look at each tooth.
That is a relief. Okay, I am ready.
Perfect. Please sit back in the chair and open your mouth as wide as you can.
Like this?
Yes, that is perfect. Now just relax and breathe. Normally, I will be very gentle.
Okay, I will try to relax.
Good. I can see your teeth now. Let me check each one carefully.
Do you see anything wrong, Dr. Sarah?
I can see that the back tooth on your right side has a small dark spot that is the cavity we talked about.
Just one cavity, is that good or bad?
It is actually not too bad, because we caught it early. If we had waited longer, it could have become a bigger problem.
That is good to hear. So what happens next?
We will need to do a small procedure called a filling to fix the cavity.
A filling? What does that mean exactly?
A filling means we clean out the damaged part of the tooth, and then we fill the hole with a special material to make the tooth strong again.
Does a filling hurt?
Before we do the filling, I will give you a small injection to make the area numb so you will not feel any pain during the procedure.
An injection near my tooth? That sounds scary.
I completely understand, but the injection is very small and very quick. Most patients say they barely feel it.
Really okay if you say so. I will try to be brave.
You are already being very brave, David, just by coming here today. I am proud of you.
Thank you, Dr. Sarah. That makes me feel better. Now I have another question.
Of course, ask me anything, David.
How long will the filling procedure take?
The whole procedure usually takes about 30 to 45 minutes. It is not very long at all.
That is not too bad. I can do that.
Absolutely, and while I am working, you can raise your hand at any time if you feel uncomfortable, and I will stop right away.
Oh, that is very good to know. Thank you for telling me that.
Of course, your comfort is very important to me now before the filling. Let me also check your other teeth.
Sure, please go ahead.
I can see that your other teeth look generally healthy, but I notice that your gums look a little red and swollen.
My gums? What are gums exactly?
Your gums are the soft pink tissue that surrounds and supports your teeth. They are very important for keeping your teeth healthy.
Oh, I see, so my gums are not healthy right now.
They are a little inflamed, which means they are red and swollen. This condition is called gingivitis.
Gingivitis is that serious.
In the early stage, it is not too serious, but if we do not treat it, it can become a bigger problem called gum disease.
What causes gingivitis?
The main cause is plaque, which is a sticky film of bacteria that builds up on your teeth when you do not brush properly.
So brushing my teeth properly can prevent gingivitis.
Yes, exactly. Brushing twice a day and flossing every day is the best way to prevent gingivitis and keep your gums healthy.
I have to be honest, Dr. Sarah, I usually only brush once a day and I never floss.
That is very honest of you, David, and I am glad you told me many people are in the same situation.
Really, I thought I was the only one.
No, you are definitely not alone, but starting today, I want you to brush your teeth twice a day, once in the morning and once before bed.
I can do that. What about flossing?
Flossing once a day is very helpful. It removes food and bacteria from between your teeth, where your toothbrush cannot reach.
I see, so flossing cleans the places that my toothbrush cannot clean.
Exactly. Think of it like this. Your toothbrush cleans the surface of your teeth, but floss cleans between them.
That is a great way to explain it. I will start flossing, I promise.
Wonderful. I am very happy to hear that, David. Now let me also check your tongue and the inside of your cheeks.
Okay, go ahead.
Everything looks healthy inside. Good job, David.
Thank you, I am glad to hear that.
Now I also want to take a dental x-ray of your teeth. Do you know what an x-ray is?
Yes, I think so. It is like a picture of the inside of your teeth, right?
That is exactly right. An x-ray helps us see what is happening inside the teeth and below the gum line that we cannot see with just our eyes.
Okay, I am fine with that. How does it work?
I will place a small sensor in your mouth and the machine will take a quick picture. It only takes a few seconds and there is no pain.
That sounds easy enough. Let us do it.
Great, the x-ray is done now. Let me look at the result.
What do you see, Dr. Sarah?
Good news. The x-ray confirms it is just one small cavity. The roots of your teeth look healthy, and there are no other hidden problems.
That is such a relief. I was a little worried. There might be more problems.
I understand, but you are actually in pretty good shape for someone who has never visited a dentist before.
Really, that makes me feel so much better, thank you.
You are welcome now. Let us go ahead and do the filling today. Since the cavity is small, it will be a quick and easy procedure.
Okay, I am ready, I think. Let us do it.
Great. First, I will dry the area around the tooth, and then I will apply a small amount of numbing gel before the injection.
Numbing gel, what is that?
The numbing gel is applied to your gum before the injection to reduce the sensation, so the injection feels even less uncomfortable.
Oh, that is clever. Okay, I feel a little better about the injection now.
Good, now I am applying the numbing gel. Just relax for about 1 minute.
Okay, I am trying to relax.
Very good. Now I am going to give you the small injection. Please stay still and keep breathing normally.
Okay, I am ready.
All done. How was that, David?
Wow, that was not bad at all. I barely felt anything.
See, I told you most patients are very surprised by how gentle it is.
You were right, Dr. Sarah. I should not have been so scared.
It is completely natural to feel scared, but you handled it wonderfully. Now we will wait about 5 minutes for the area to become fully numb.
Okay, so my mouth will feel strange while it is numb.
Yes, you will feel a tingling or heavy feeling in that part of your mouth, and you will not be able to feel the tooth, but that is completely normal.
How long will the numbness last after the procedure?
The numbness usually lasts about 2 to 3 hours after the procedure, so be careful when eating or drinking during that time.
Why do I need to be careful?
When your mouth is numb, you cannot feel if something is too hot or too cold, so you might accidentally burn yourself or bite your cheek.
Oh, I did not think of that. Thank you for the warning.
Of course, now the area is numb, I am going to start cleaning out the cavity. Please keep your mouth open and stay as still as possible.
Okay, I am ready.
I am using a small drill to gently remove the damaged part of the tooth. Do not be alarmed by the sound, it is just the machine working.
The sound is a little strange, but it does not hurt at all.
Perfect. You are doing wonderfully, David. Just a little bit more.
Take your time, Dr. Sarah. I trust you completely now.
Thank you, David. That means a lot. Now I am finished cleaning the cavity. I will now place the filling material inside the hole.
What is the filling made of?
We use a tooth-colored material called composite resin. It looks just like a natural tooth, so nobody will be able to see it.
Oh, that is great, so it will not be a silver color.
No, the composite resin filling matches the color of your natural tooth. It is much more aesthetic, and most patients prefer it.
That is wonderful. I was a little worried it would look strange.
Not at all. It will look completely natural. Now I am placing the filling and shaping it to match your tooth.
How does the filling stay inside the tooth?
The material bonds directly to the tooth, and then I use a special blue light to harden it so it becomes very strong.
A blue light, that is interesting. How does light harden the material?
The blue light activates a chemical in the composite resin and causes it to harden and become solid in just a few seconds. It is quite amazing.
Dentistry is really fascinating. I had no idea so much science was involved.
Yes, modern dentistry uses a lot of technology and science to help patients quickly and comfortably.
I am very impressed, Dr. Sarah. You really know what you are doing.
Thank you, David. That is very kind of you. Okay, the filling is now complete.
It is already done. That was so fast.
Yes, because we caught the cavity early, the procedure was very quick. Now let me check your bite to make sure everything feels right.
What does checking my bite mean?
I will ask you to gently close your teeth together, and I will check if the filling is at the right height, so your teeth fit together comfortably.
Okay, let me try closing my mouth.
How does that feel? Does the filling feel too high, or does it feel natural?
It feels a tiny bit high on one side.
Thank you for telling me. I will make a small adjustment right now.
Okay,
Try again now. How does it feel?
that feels much better now. It feels completely natural.
Perfect. The filling is done and everything looks great. David, you did an amazing job today.
Thank you so much, Dr. Sarah. I cannot believe I was so scared before. This was not bad at all.
You were incredibly brave, David. I hope this experience shows you that dental visits do not have to be scary.
It really does show me that I wish I had come sooner.
Better late than never. The important thing is that you came and now you know how to take care of your teeth properly.
Yes, I have learned so much today, Dr. Sarah. Can I ask a few more questions before I leave?
Of course, take all the time you need, David.
What should I eat or avoid eating after the filling today?
Because of the numbness, I recommend waiting at least 2 hours before eating anything and avoid very hard or sticky foods for the rest of today.
What about tomorrow? Can I eat normally?
Yes, from tomorrow you can eat and drink completely. Normally the filling is fully hardened and very strong.
That is great to hear. And how long will the filling last?
With proper care, a composite resin filling can last between 5 to 10 years, or even longer.
Really that long? So if I take care of my teeth, the filling will stay for many years.
Exactly, the key is to brush and floss, regularly avoid biting very hard objects like ice or hard candy, and visit the dentist regularly.
Speaking of regular visits, how often should I come to the dentist?
I recommend coming every 6 months for a routine checkup and cleaning, even if you have no pain or problems.
Every 6 months, okay? I will make sure to do that from now on.
That is wonderful to hear, David, and if you ever feel any pain or discomfort between visits, do not wait. Come and see me right away.
I will. I promise now I understand why regular dental visits are so important.
Exactly. Prevention is always better than treatment. It is much easier to prevent a problem than to fix one.
That is very wise advice, Dr. Sarah. I will remember that.
Thank you, David. Now let me give you a few final tips for taking care of your teeth at home.
Yes, please, I want to learn everything.
First, brush your teeth twice a day for 2 minutes each time. Use a soft toothbrush and fluoride toothpaste.
Okay, soft toothbrush and fluoride toothpaste for 2 minutes twice a day, got it.
Second, floss between all of your teeth at least once a day, preferably before bedtime.
Before bedtime. Okay, that is easy to remember.
Third, reduce your sugar intake, especially sticky sweets and sugary drinks like soda and juice.
I will try to eat less candy and drink less soda. That might be a little difficult, but I will try.
You do not have to stop completely, just reduce the amount and always brush your teeth after eating sweets.
That sounds manageable. What is the fourth tip?
Fourth, drink plenty of water, especially fluoridated tap water, which helps strengthen your tooth enamel.
Interesting, so water is also good for teeth. I did not know that.
Yes, water helps wash away food particles and bacteria, and the fluoride in tap water actually helps protect the enamel.
I will start drinking more water then, and what is the fifth tip?
Fifth, and finally, do not use your teeth as tools. For example, do not use them to open packages or bite your nails, as this can crack or chip your teeth.
Oh, I am guilty of using my teeth to open things. Sometimes I will stop doing that.
Good, those 5 habits will make a huge difference in the health of your teeth and gums.
Thank you so much, Dr. Sarah. Today has been a real eye-opener for me.
I am so glad to hear that, David, taking care of your teeth is an investment in your overall health.
You are absolutely right. I feel so much more confident about dental visits now.
That makes me very happy to hear. Would you like to schedule your next appointment before you leave?
Yes, please let us schedule it for 6 months from now.
Perfect. I will have my receptionist set that up for you at the front desk.
Wonderful. Thank you for everything today. Dr. Sarah, you have been so kind and patient with me.
It was my absolute pleasure, David. You were a wonderful patient. I look forward to seeing you at your next visit.
Me too. I cannot believe I used to be so scared of the dentist.
Remember, David, a healthy smile is one of the most important parts of a healthy life.
I will never forget that. Thank you, Dr. Sarah. See you in 6 months.
Take care, David. Keep brushing, keep flossing, and keep smiling. See you soon.
Goodbye, Dr. Sarah. Have a wonderful day.
Goodbye, David. You too. Take care of yourself and that beautiful smile.